Hello everyone, we are back with another segment in our series of talking to Dr. Stachowicz about breast cancer, from your initial diagnosis, the pre and post care ideas and thoughts behind what's going to be helpful for you. We also talk about metastatic cancer. We've kind of covered
Recovering,
recovering,
coming back to regular activities.
exactly, exercise, all of those topics that I think are important for women to know about. And then today we're going to talk about revisions. I think a lot of women think that they're going to go have that reconstructive surgery and then they're done. But there possibly is more to that, so we'll let Dr. Stachowicz expand on that. And then the other piece of it is just being a resource, giving you information about different resources, support groups, things like that that can be very important for women during this process as well. So thank you for being here today.
It's my pleasure, as always. Well, not uncommon. I find myself answering questions about maybe reconstruction or surgery that did not turn out as well as the patient expected.
Okay.
And it is not uncommon that the patient simply found out about a new procedure, maybe heard about it in an informal setting, or maybe met somebody who was recently diagnosed, realized that their reconstruction is different than theirs, and inevitably the question comes up, well, my symmetry is not appropriate, or one implant is higher than the other, or now, years later, the size appears to be too small or too big. You know, I've gained weight or I've lost weight, and things are different. And for a number of those patients, they struggle with that. They think that that reconstruction is done and over, and that there's no additional options. And in fact, with insurance coverage, sometimes with prior authorization, we can simply plan and perform a revision of previous reconstruction, even if it was a 10 years ago surgery. So in other words, schedule an appointment. We'll examine the patient. We'll find out what exactly is the troublesome issue. I will be happy to give an opinion about what options are there. Do we need to release the scar? Do we have to revise the scar? Maybe we need to perform the lift on a healthy remaining breast. Maybe the implant needs to be exchanged. And sometimes the revisions can be very simple. They may even be done under local anesthetic with minimal recovery and accomplish quite a bit of change. Sometimes it's the looseness of the skin, typically in the armpit area, that is bothersome, and it's just uncomfortable when the bra is worn. Again, that frequently may be removed in a very short, several minutes long surgery. And all has to start with a consult.
Sure.
It doesn't mean that the surgery has to be done, but I think that's where you get the options, I think, clearly delineated.
Absolutely.
And then we go from there.
Absolutely. I think it's important for women to understand that at that time when you're getting that initial reconstructive surgery, it might be immediately right after your mastectomy. And I think women don't realize that there are options to later realize, oh, this isn't working for me, whatever
Correct.
it is. You know, especially if women get just have that single mastectomy, coming back, you know, a year or so later and realizing they need to
the
do
healthy
something
breast,
with the healthy breast.
the remaining breast will change
Sure.
with time, whereas the reconstruction after a year or so is unlikely to change.
Sure. So that's good for women to know. And I think also what you were saying too is that it can even be 10 years later and you can still get it covered with maybe a pre-authorization.
Absolutely.
So I think that's really important for women to know, and not necessarily something that's communicated at the time of their initial surgery. So
the initial time of surgery and diagnosis is always so busy that even if those issues are mentioned, they're not remembered.
Sure.
Based on my experience, patients do not remember those
conversations.
Less important at the time elements.
Sure. Absolutely. I think the other thing too is I've heard that at some point you have to get implants, whether it's for reconstructive or for augmentation, that you have to get those replaced. What's the timeline on that these days?
It's probably closer to 20 years. That is, I think with saline implants, which are now very rarely used, those times are about 10 years. But as far as the sort of notion that implants has to be regularly checked and looked at, scanned, and so on, that is more of a myth.
Okay.
In fact, if there is an implant failure that requires replacement, you simply would typically notice it by change of the shape of the reconstructed breast, or even the cosmetically augmented breast, which prompts investigation at that time and possible replacement. And again, specific plan for scanning the implant does not have to be in place.
Okay. Well, that's good. Great information to know and to be sharing with everyone.
And as far as timing, I think it's reasonable to wait up to a year. There's a lot that can happen during the first year to the scar tissue, to the capsule, or even a flap-based reconstruction in terms of skin relaxation, stretching, massage, exercise. All that can affect the final appearance. But if the reconstruction is asymmetric or painful or uncomfortable or just does not fit what the expectations were after a year, then it's reasonable to get another opinion or with the same plastic surgeons or another, and simply ask what else can be done.
Sure. And I think it's important to note too at that time, if you liked your plastic surgeon, definitely go back to them. But if you had an issue with them, weren't happy with how they handled the situation or even bedside manner. I've always talked about how Dr. Stachowicz is very good about communicating with his patients every couple days, sending text messages to check in on them. And I think that's a huge piece that women really appreciate during this difficult process. So that's just something to be aware of. And then also, of course, do your research, talking to others, making sure that they are board certified, those sorts of things. But I think does that cover?
That kind of covers most of it. Again, each case is different.
Absolutely, yes.
I would again remind not to compare yourself to a friend of a friend or a neighbor or even somebody in your family, because every one of those cases will be handled somewhat differently. But the best thing is to find an expert, have a consultation, find out the options, and then think about it.
Yep. Well, good. I think that kind of basically covers what we wanted to discuss about revisions. And then as in regards to resources, for us, for heart&core, we really try to think about and share information that we think will be helpful to women, whether it's everyday bras that they're going to get back into after their surgery, whether it's support groups, different things like that. So I guess I'll start with the support groups. Do you find that the hospital offers good support groups, or what are your thoughts on that?
I think from my residency days till now, the change is dramatic. That is, in general, most breast centers, most hospitals that deal with breast cancer will have options. But I always found the groups where I meet in the hospital, when I spoke or gave talks or answered questions, they always tend to be a little sterile, which is what hospitals are.
Yeah.
And sometimes they're very poorly attended. There's subconsciously, I think, resistance to just simply going to a hospital, which is more or less an elective occasion.
Yes.
I think most people would simply rather not.
Yep.
I found the groups that meet more informally, and I've done also some of those type meetings and question and answer sessions. They tend to work better.
Yes.
I think they're just simply more relaxed, and they're more conducive to sort of a more open thinking. If this location is more convenient than a downtown hospital, then parking is easier.
Absolutely. There's a lot of things.
And coffee is probably better too.
Yes, exactly. I think that's the biggest thing is I'm reading more and more articles about how they're trying to look at the whole picture, looking at the psychological issues, the fears, everything else that comes with it, and also the support for the families. One group locally here is Gilda's Club, based from Gilda Radner, having cancer back in the 70s. And basically they've got different groups around the U.S. actually for Gilda's Club, and I know the one here locally is great. They have a great facility. It's very cozy. They've got support groups that meet there. They also have people that come in and speak, but they also have a very family style setup in the fact that if you need to come to a support group where they have childcare available there, which I think is definitely helpful. and just a really good supportive environment. So that's one that I would recommend. But also, I think that there are lots of different organizations that have access to that information as well. So it's always good. You can look at our Facebook page. We'll share some information as well, and just be aware of there are resources outside of the hospital. And normally, I know they'll give you a sheet too that'll give you some outside information. But I think that's probably
couple points. If you want to organize an informal group, I'll be happy to show up.
That's great.
And I mean it. And also, don't forget to ask wherever the treatment is. There are typically lists of patients that are willing to speak to the newly diagnosed patients. Again, in the busyness of those planning days, that is frequently forgotten.
Yeah.
But in fact, I found and I managed to connect some of my patients with my former patients. Okay. Again, without violating all the HIPAA regulations.
Right.
There is a way to do it. And that usually is a very positive experience. It's nice to have somebody who can be simply called on a phone and asked a question based on their own experiences.
Yep, I think that is very good to note, and it's always helpful to know someone who's been through it, because even though your experiences may be different, the overall idea of going through breast cancer and the stress of it, absolutely.
The issues of depression, sadness, or just simply not, even simple things like not eating or not sleeping, those can be easily related to.
Yeah, exactly.
Absolutely.
Well, we will share some information below, some links and different resources that we can share. Please feel free to add resources if you have some as well, or ask questions, and you can message us as well. We'd be happy to answer your questions. And that's about it, right?
Absolutely.
Thank you for being here today.
Absolutely. And we'll be back.
Yes.
Thank you.
Thank you.